So I'm just going to introduce Dr. Aisha Ashmore. She's a clinical research fellow here at Derby and Burton. She's an ST5 trainee in the East Midlands, but she's out of programme doing her PhD in ovarian cancer at the University of Nottingham. Aisha has a master's in public health, and she's also completed the National Medical Directors Clinical Fellowship, where she's led national projects in cancer and maternity care with the CQC. She currently is an honorary fellow for NICE with the Women's Health Suite team, and she's very keen to do subspecialty training in gynae-oncology in the future. So I'll hand over to you.
Thanks so much, Anna. So thank you everyone for listening. So I'm just going to introduce the two videos that we have. So I put this together with the help of our clinical nurse specialist team, and so big thank you to them as well, especially Claire, and also thank you to Pat and Carol for sharing their experiences with us. So I just wanted to say a few words before we started about why it's really important and why actually a lot of people really enjoy this part of the symposium. So as clinicians, sometimes we may not always recognise or appreciate some of the nuances of the patient journey, and understanding these nuances can actually help us develop a more holistic approach to care and develop better services for the people that we serve. And on top of that, engaging with these potential issues or unexpected positive experiences can also really empower patients and improve their involvement in their ongoing care. So without any further delay, we're going to start off with Pat's video. Thank you.
Okay.
So I'm Patricia Harrison. I am 80 years old, at the moment quite fit and healthy.
What symptoms did you have initially?
I had a bit of a discharge, a bit of a yellowy discharge in the beginning, and I thought, oh, I actually thought I got a prolapse.
Okay.
I don't know why I thought I got a prolapse. I think I was a little bit uncomfortable, especially when I was sitting down. I thought, oh, and I thought that's what it was. And then I had a bit of a bleed, and I thought, no, maybe I should go and see my GP, which was why I went. And just I phoned one day and had an appointment the next day and was examined by my GP, and she said, no, I'm going to refer you. And I was seen within 3 weeks, and I had a scan. I think that concerned me a little bit, the fact that I knew it should have been 2 weeks and it was 3, and then it was a bit longer again to have the scan, and because it was over Christmas, of course, units was closed over the 3 bank holidays, and I think again that concerned me a little, but I mean that was something that was unavoidable, and then I had a hysteroscopy in the unit, so it was all done on the same day. The person who did the hysteroscopy said they would be referring me probably to an oncologist, so at that point I realised possibly that it was a cancer. I know a lot of people find the hysteroscopy extremely painful. Yes, it was uncomfortable. I suppose it was painful, but I just had to. I'd rather have had it done on the day.
Yeah.
I was given the opportunity to come back and have it done on the day case unit. I said no, I'd rather have it done, get it done. I was then seen by one of the specialist nurses, who went through everything with me and explained exactly what was going to happen. My daughter-in-law was with me, so it was a bit of a shock when she did say it was stage 3, but it was. But the experience with the specialist nurse was quite positive.
And why would you say that?
I think she was just quietly explaining what was going to happen, and how long it would probably be, and how long it would be before I came back to see the consultant. But yes, just made you feel at ease.
Once you got your diagnosis, what kind of treatment did you have?
I went for an MRI scan, and was it the CAT scan, and then came back. I can't remember to see Mr. Abdul, who then no, I'd seen Mr. Abdul before that. In fact, I got it. Yes, I came back in December and saw Mr. Abdul, and that's when he said it was stage 3, and to go then for an MRI scan, which I had, and then came back on the 24th of December when he gave me the results of the scan, which said it doesn't look as though there was any spread anywhere, which was, again, made you feel a little bit more confident. And at that stage I also had pre-op on the 24th of December and given a date to come in for the hysterectomy, which he explained was going to be done robotically, with just through a laparoscope. So I think the more worry I had was the fact that it might get cancelled due to COVID.
How did you feel before you went into theatre? And after, I suppose?
Obviously, and didn't sleep very well the night before. In fact, probably didn't sleep at all. Apprehensive, but not, I wouldn't say I was terrified. Afterwards, well, when I went down into theatre, I had a spinal, which was for pain relief. And then it was an injection in the back of my hand, off to sleep, and the next thing I knew was, you know, you're going to wake up, we're taking you back to the ward now. And the most uncomfortable, I had no pain whatsoever. The only thing that was uncomfortable was the catheter. And I did find that very, very irritating. It was,
even with the spinal in? Even
with the spinal in, yes. The catheter I found really, really uncomfortable. And that was the worst, that was actually the worst part of it.
Oh, really? And how about in the next few days? Well,
I went home the following day, and again, no pain, just paracetamol, that was all. I felt okay. I mean, I went home, my son had come to look after my husband, but at that point he hadn't been diagnosed with dementia. But we did know that he got a problem, and we couldn't leave him overnight. So my son came down from Yorkshire to stay with him. And I think I went home, looked in the freezer to see what we could have for tea, and was told to go and sit down.
So how have things been, you know, since your operation? How have you coped with the diagnosis? Have you had any problems or complications?
No, I think once I'd had a hysterectomy, it was a relief, and then it wasn't until it was getting closer to coming back for the results, because they'd obviously taken glands out as well. And I sort of started to think, oh yes, I wonder, could there be, you know, am I going to have more treatment? But as it happened, Mr. Abdul said the glands were all clear, but they would do belt and braces, brachytherapy, just to be sure.
How was the brachytherapy?
It was okay. I did read up on it, so I did know what to expect. It was a slight sensation down your legs rather than when you're actually having it. A strange sensation. I can't describe it really, but again, that was fine. And the same specialist nurse that I'd seen came to the unit to explain about it.
Was it nice having that continuity?
Yes. And then I had 3 sessions, which 1 week apart. And then at the end of that, I again saw the specialist nurse, who then explained about having to use dilators because of the brachytherapy, you know, could cause adhesions.
And did you have to use them?
Yes.
How did you find that?
Okay. It was, I think when you've had children, it's probably difficult for somebody who's never had children or hadn't been married, but no, it was all right. I had to use them for a year, daily to begin with, and then towards the end it was just weekly.
Okay. And you haven't had any problems with adhesions or scarring
No,
in your vagina?
No, I'm come for 6 monthly outpatient appointments and uses a speculum and examination. So no, and that's not uncomfortable.
A lot of women who have their glands removed, they struggle with something called lymphedema.
Yes.
Have you had any problems
Yes.
with that?
Yes. This left leg have got some lymphedema in it.
And how have you been managing with that?
So that's all right. It's not too bad. I do, when I'm sitting, I do have my feet up, but I'm rather active and I don't sit down very much.
Has it impacted your lifestyle at all?
No.
No. Have you had any problems with infections or?
No.
That's
No.
very good.
It was extremely bruised, and particularly uncomfortable down the groin area where the glands have been removed. But apart from that, no. I think I really wanted to run before I could walk. But then your body tells you, no, you can't do that, or you shouldn't have done that.
Yeah. How long was it between you having your operation and then you getting back to what you would call normal?
I do a lot of gardening. We grow all our own vegetables, and it was a bit frustrating to begin with to not be able to do some of the things that I would normally do. Probably 3 months, but even after 3 months, if I did something, it's, your body tells you, no, you really shouldn't do it. I didn't dig. I did leave that. And I would say it was probably before I was completely 100% back to normal, possibly up to a year.
Okay. Is that something that you were aware of before you went to have all your treatment?
I knew it would be 6 months. But I mean, I did. I was very careful when it came to lifting things like bags of compost or get somebody else to do it for me. Yeah. But I would do a lot of bending, and then I'd think to myself, oh, that's a little bit uncomfortable, even at 6 months. But then, of course, 9 months we're going back into autumn again, so I wasn't doing quite so much. But yes, back to normal now.
Good. Doing
everything that I was doing before, even playing badminton.
Interested to hear about your experience, because you told me before we started doing this video that you had previously worked as a gynae nurse.
Yes.
And I'm interested to hear about how you think things may have changed in terms of how people's care since.
Oh, considerably.
Between you being, a staff member and you being a patient.
Well, people were in hospital for 5 days more. They'd be admitted the day before, usually for their operation. The latter stages of my career, it was usually the morning or the day of their operation, and it would be usually transverse, and with stitches or with clips, which you would take out on day 5, and all being well, they would go home. I think one of the things that a lot of people complained about was the shoulder pain, the referred pain in the shoulders. We used to give them a mixture of bicarbonate and peppermint, which was always a relief for them. But yes, I mean, and they didn't mobilise as quickly, obviously, as I did.
Actually, a good question is about language that we use. Obviously, you have a medical background and you were able to interpret a lot of things that we said.
Yes.
Is it something that we need to improve?
Probably some people don't know what a uterus is. They refer to it as a womb. What else? I think most people know what a cervix is. But if you don't understand the anatomy, and you don't know that how your anatomy is with the fallopian tubes and your ovaries, perhaps don't understand quite exactly what they're going to have taken out, whereas the booklets you were given explained all that. But I knew all that. Yeah. That when you had a total hyst and a BSO, you were going to have your ovaries, your tubes, your cervix. Yeah. Everything was going to go.
Did you find the information leaflets useful?
Yes, but a lot of it I already knew. So to somebody else who's not medically or didn't know anything about gynae. Yes.
So I also wanted to ask you about how the gynae cancer specialist nurses have supported you through your journey, and could you tell me a little bit about that?
Yes, they. I mean, I saw the specialist nurse was in when I got my results, and I got a phone number. I've got a card in my wallet that if I required any, to speak to anybody, she gave me all the information on the cancers and all the booklets, which I'd had before I had the operation, and with the phone number to be able to phone if I needed any help. And then she was there when I had the brachytherapy. That was explained to me, and again how to use the dilators. And really, I haven't really needed any further help from the specialist nurses. I suppose in a way I've just sailed through it.
I understand that you saw not only our specialist nurses, but you saw some specialist nurses from the radiology department.
Yes.
Yes. How did they support you?
She was there at my first clinic appointment with the radiography appointment. That was before I had my treatment, and she explained to me exactly what was going to happen, and she was there when I went in for my first treatment as well. But it was the gynae specialist nurse who showed me how to use or explained how to use the dilators. But yes, I saw her on my first appointment. I don't think I saw her after that one, but she did explain everything to me. But that was explained in clinic before I actually went for the treatment.
Do you have any messages that you would give to anyone else who's going through this at the moment?
You could say not to worry, but I mean, obviously, people are going to worry, aren't they? You could say the actual operation is nowhere near as bad as you think it's going to be. Mm-hmm. Your recovery is quick, fairly quick. If you're having a spinal, the pains, there's very little pain. Although you were given painkillers and you were given things like Senecots for your bowels, but just to eat a healthy diet. Eat well, eat the things, eat plenty of fibre, and take the painkillers as required. Yeah. But it really isn't as bad maybe as you think it's going to be.
Carol, can you tell us about your cancer journey and any reflections that you might have had?
Yeah. Well, I was diagnosed with endometrial cancer at the end of 2020. I found some blood that shouldn't have been there and went straight to the doctor, and she referred me to Burton and for tests. It was a shock and a sort of guilt feelings, really. That I had a diagnosis of endometrial cancer then from Burton, and it was a shock, and I felt guilty. I thought it was a result of me doing something or not doing something I should have done, and the whole gambit of emotions I went through. I was really, really well cared for, and within a month I'd sort of seen the doctor, and everything had been explained to me very clearly, and in ways I could understand, in a language I could understand as well. And I'd had an operation, a hysterectomy, and but they found that the cancer had spread slightly, which again was a terrible shock and fear. All sorts of emotions you go through. And then I was asked if I wanted to have another operation to remove my lymph nodes, because they weren't sure if the cancer cells had actually reached my lymph nodes. As I'd had a friend 20 odd years ago who had had breast cancer, and they thought it was all clear at first, but then found it had gone into her lymph nodes, and she died 3 years later. So again, it was fear, and I just said to the surgeon, I want them out. Can you take them out? Can you take my lymph nodes out? Which he agreed to do, and I found to be negative. So you know, that was that. And then I had brachytherapy. The whole thing, I never suffered any pain or discomfort or anything. And as I say, the staff were really, really helpful, really, really caring, and I couldn't have wished for better, really. And here I am today. It's 3 years later, and touch wood, everything is clear so far. So made me appreciate life, certainly, and what I've got, and how lucky I am to be here. And thanks to the NHS staff, who will always remain my heroes.
How did you find the diagnostic procedures?
Everything was fine, apart from just the first one I went for, and they did a biopsy, and that was quite painful. But other than that, I never felt any pain, any discomfort, anything. I don't know whether I was just lucky or how it was. Even the operation, the hysterectomy, I wasn't looking forward to the actual operation, because I've had operations before and you wake up feeling pretty lousy, and you know, and I've been in some pain before, but this time I think it was keyhole surgery, and I woke up. I didn't feel ill, no pain, no discomfort, absolutely nothing. It was amazing. It was really, it was quite a shock to me, really, because I expected to feel some discomfort, you know, something, but it was nothing. No, it was all very, very, very comfortable, very easy.
How were you when you got home?
Absolutely fine. Absolutely fine. In fact, I didn't have to, I had to keep reminding myself not to do things. There were certain things that, you know, you instinctively might do, or you think, oh, you know, I'll get on with that. And I had to remind myself that I can't, you know, I shouldn't do it.
So how has life been since the diagnosis and since the treatment?
Well, very good. Very good. You know, my health, touch wood, again, has been good. I'm so thankful and appreciative, you know, to be here, and that my health is okay. And the worst part, I think, about it all was waiting for the results, because you can't plan your life. You can't, you know, you can't really sort of move on until you know what's what.
Did you have any problems with lymphedema?
What I found was that when I had the hysterectomy, and when I went back to see the specialist afterwards for the results and everything, and he told me that it had spread, and they didn't know whether it had actually reached my lymph nodes or not, and because I'd had this friend who it had happened to, I just immediately, without thinking, said, get them out, take them out, you know, can you just remove them? And I wish now that I'd have had more time to perhaps reflect on it and think about it, because I didn't know, we didn't know whether the lymph nodes were, the cancer cells had reached the lymph nodes or not. And I could have had a biopsy to tell us. Instead of that, I had the lymph nodes out, and of course I've developed lymphedema since then. But I'm going to the lymphedema clinic, and that is fine, and managing it that way, and it's not a great difficulty at the moment for me. But of course, I think had I been given time to reflect, I think I'd have probably asked for a biopsy to be done first.
Can I ask a little bit more about the lymphedema?
Yeah.
So what kind of things are they doing for you in the clinic? And
I've got stockings, and she, the nurse has shown me how to do some massage, But the stockings seem to keep it pretty much in check at the moment. The only thing was that they're quite hot to wear in the summer when it's hot, and we went to Morocco for a holiday last year, and of course it was quite hot there, and of course I couldn't wear well, I could have worn them, but I didn't wear them in the heat, so I had to be very careful regarding that, really. So I sort of wore them at night when I was wearing a long dress, and sort of left them off during the day. But it's those sort of things, really, when it's vanity, I suppose. When you want to wear something nice, a nice dress or something like that, and then your legs are swelling up, or you've got to wear thick sort of stockings. It's not so good, but it's a minor price to pay, I think, for having my life. And
how have the cancer nurse specialist teams supported you throughout your journey?
Oh yeah, well, they've been there for me. I think my cancer was pretty uncomplicated, wasn't it? It was sort of quite straightforward, and I mean, I know in the beginning, when I first knew, and I was waiting for the operation, that was the time when I was feeling, say, I ran the gambit of emotions, really. But the nurses helped in listening to me and reassuring me where they could. But of course, the thing I wanted most of all was for someone to come and put their arms around me and say, it's going to be okay. Everything's going to be all right. You'll be cured, which of course the nurses can't do, and the doctors can't do. But I think to have someone just to talk to and listen to you, and I can foresee if you had any real problems with family and things like that, they could be a lot of probably practical help as well in pointing someone to the right direction, of who they could turn to for help.
What message would you give to other women going through this?
Oh, try not to worry. And ask questions of people. The doctors, nurses, ask them whatever you need to know. Be vigilant about having checkups, and I mean, I think young girls or women with the screening, the cervical screening, to be really, really, on the ball about it. It's a case of being hopeful, I suppose, and talk to people. Talk to people about how you're feeling, and I think people close to you want to be there for you and want to know how you're feeling. And spoil yourself a little bit,
That's great, Anna. Thanks for sharing those. So yeah, I think it's really insightful to hear a patient's journey, and we thank them both for sharing that with us. And a special thanks also to our CNS team, led by Claire Hill, for supporting us in reaching out to the patients and then supporting the patients, taking them through the preparation of those videos. So any comments from the delegates, from the audience, before we move on to the next speaker?
Claire, are you there? Did you want to put your video on?
Here, but my video isn't the best, so
Okay, that's fine.
I'm here if you want me to.
That's all right, don't worry. All right,
Hi,
no,
Claire,
don't think there's any comment.
thanks so much.
Thank you.
And
Thanks,
lovely
Claire,
to
that's
hear.
brilliant.
the feedback from the patients, you know, how important you and the team are at every sort of step along the way. So
There's a raised hand, Susie. Nima, do you want to ask your question and turn your video on?
Yes, hello, hi. Are you able to hear me? My video is
Yes.
not working well.
Yes, we can hear
Right.
you.
So I want to thank everyone for this amazing program. I've learned a lot today. And my question is, I'm a newly diagnosed nurse hysteroscopist, and I see a lot of like referral for postmenopause. It's not relevant to the video that I've just watched now, but it's more of a broad question. And I get a lot of referral for postmenopausal women who also have an endometrial thickness. And when I investigate and do the biopsy, sometimes it comes back as atrophic or normal, and then we kind of discharge them back to the care of the GP. But is there, and then I get worried about, oh my God, maybe have I missed something, or could I have done more? So just for reassurance purposes, is there anything or any advice that anyone can provide to kind of just, because I don't want to obviously miss anything, and then I mean it's just a bit, how could I make sure that there's nothing more that I've missed other than doing all the things that I've just, you know, done?
Yeah. Shall I answer?
Yep,
So
go for
I
it,
mean,
Susie.
if you've had a hysteroscopy biopsy and you've had an atrophic result, then you know they've had thorough investigation. So we would always safety net by saying to patients that if they have recurrent or persistent bleeding, that they re-present themselves via the GP to the service, and then we can revisit things. Also, atrophy in itself can be a cause of postmenopausal bleeding. So if you've excluded any precancerous or cancerous change, then a trial of vaginal estrogen, you know, under the care of the GP to follow up, you know, would be an appropriate step as well. And women might respond to that and as such have no further bleeding.
Yeah,
Yeah.
I do take all those steps. Yeah. So, okay, that's amazing. And just one more thing is, one
Nima,
more
sorry,
question.
Nima, just a quick reiteration of that. Over 80% of all patients will have atrophic vaginitis. So it's a very common thing, as Miss Adley says. So HRT, as she rightfully says, is work, but reassured that it's unlikely there's going to be anything else that's going on.
Oh, that's fantastic. Thank you so much. And just last, this is again another just comment. Due to where I work, the population of the ladies that we see, they're not always keen on Mirena insertion as a preventative measure. So is there any suggestion or any comment that you can provide so that I can convince them more to, obviously it's personal choice and it's consent, and we always have to listen to patient's choice, but is there anything further that we can do to kind of emphasize on the importance of Mirena and the prevention of endometrial cancer? Thank you so much for the program.
I'm not sure. I mean, we wouldn't necessarily routinely put in Mirenas unless there was a good indication, especially in the postmenopausal women. So I think if you've got an indication, then I think just explaining the benefits to them, explaining there's less systemic side effects, and just trying to give them information leaflet is all you can do, really. Okay, thank you.